Okay.
Good afternoon, and thank you so much for inviting me to be a part of this timely and critically important plenary session to commemorate the 10th anniversary of the Minority AIDS Initiative, and more importantly, to commit to a stronger, expanded, renewed initiative. As a new member of Congress, I've literally cut my eye teeth on the Minority AIDS Initiative under two of the most effective members of Congress, Congresswoman Maxine Waters and Congressman Lou Stokes. As heir to Congressman Stokes' Health Brain Trust, I, along with Maxine, have been the stewards of the initiative and its funding. So with my schedule not permitting me to be there in person, I'm very glad that I could be there with you via video. Participating in this conference this weekend reminds me of the one that was scheduled 7 years ago, on the weekend following the terror of 9/11/2001. The conference didn't happen, of course, and while we remembered and honored those who died that day just last week, and those who gave their lives in the erroneously connected wars in Afghanistan and Iraq, the juxtaposition of that event and this conference reminds us of the tens of thousands who have died from AIDS, mostly people of color, and the meager response to that catastrophe that continues to disrupt lives even today. So let me begin by saying thank you, National Minority AIDS Council, not only for organizing this plenary and for convening the 2008 United States Conference on AIDS, but for your continued leadership in the effort to fight HIV and AIDS and to keep its disproportionate impact on racial and ethnic minorities on the national radar. That this year is the 10th anniversary of the Minority AIDS Initiative, and that this year the Centers for Disease Control released new incidence numbers which show an estimated 56,300 new HIV cases occurring every year in the United States, not 40,000 as was originally reported. This conference could not be more timely. I often use the word hijack to refer to what happened over these 10 and especially the last 8 years of the Minority AIDS Initiative. And I firmly maintain that if the initiative had been allowed to remain true to its original intent, we would not be in the situation we are today. That African Americans are so disproportionately impacted that some segments of the Latino population also bear a high burden of HIV/AIDS, accounting together for almost 70% of all AIDS cases, and that the overall small number of cases in the Native American population hides a 900% increase since 1990, are due to the fact that the state of emergency and the resulting Minority AIDS Initiative that the Atlanta 30, led by Dr. Betty Prim, called for was never adequately funded and not used to build capacity in our own indigenous community and faith-based organizations to the extent that it was intended to. While funding of the initiative has steadily risen to approximately $400 million today, the HIV/AIDS cases among racial and ethnic minorities, along with the cost of care for those with HIV and their families, have far outstripped that number. We're meeting on this vital issue at an exciting time, a time of great promise and a time when change is within our reach. But within reach is not good enough and will not ensure the willing environment to successfully release the stranglehold HIV and AIDS has on communities of color. So if we're serious and not just meeting for meeting's sake, we have to start by doing everything that we can to ensure that we elect a president who represents and will bring about the change we need, and members of Congress who will as well. If we don't do that, we can forget it, and the CBC's first effort is always to ensuring that the right leadership is in place. The CDC report and others, especially that of the Black AIDS Institute, as well as the work of the Clergy Conclave, build on the work of many other groups like NMAC and individuals, and they provide a great foundation for moving ahead. The CBC, under the leadership of Congresswoman Carolyn Cheeks Kilpatrick, our chairwoman, has reconstituted our HIV and AIDS task force, headed by the person who started it all 10 years ago, Congresswoman Maxine Waters. We are putting the work of the conclave into legislative language, and we will review and amend it as well as share it with the wider HIV/AIDS advocacy community so that we will be ready with a consensus document early in the next Congress. Our aim is to have this bill lay out a national plan built with the revamped Minority HIV and AIDS Initiative at its core. It can be developed and implemented no other way, given the face of HIV and AIDS in this country. And we must authorize within it the domestic PEPFAR that Phil Wilson calls for in his report. And as we have consistently done, we will ensure that the forthcoming plan include provisions and programs that bolster prevention, which includes comprehensive sex education, needle exchange programs, and expanded HIV testing, and that it adequately and appropriately meets the needs of the incarcerated and ex-offender populations. So we are indeed looking backward, 10 years back, at the call for the state of emergency and the creation of what was to have built capacity in our communities which bear the disproportionate burden of this disease. It was not allowed to happen because the funds were never targeted as they should have been. Audits were targeted though. Then the rules of the game changed, effectively closing many agencies that were making progress. And now the General Accountability Office is assessing the effectiveness of a program that never became what it should have been. So we must look forward with new vision and stronger determination. As our next president has said, this is our time to live, to be healthy, and to create communities of wellness for all, and a country and a world free of AIDS. Thank you, and have a productive conference.